Some of you have probably been through just-in-time trainings, others maybe not. But we've developed a model, and so we'd like to share that with you today. That's kind of why you're here. We're going to share the model with you. We're going to get you familiar with it. We're going to talk about how it applies to the work that you guys do every day. And then we're going to spend the last part of our hours together doing an actual kind of mock exercise or a nice interactive activity to exercise the model a little bit and get you guys kind of used to a potential job that you could do in an emergency response. What I wanted to do now is orient you guys to our inclusive just-in-time training model. So this is our model. This is what we call our I-JITT. We call inclusive just-in-time training I-JITT for short. The first principle is learning dimensions. It's the knowing, doing, feeling component that a responder has. The second principle in our I-JITT model is learning styles. Pretty straightforward. We all learn differently. Some of you might be more auditory. Others work really well with PowerPoints or things in front of you. Others are experiential or kinesthetic and really need to learn by doing. The last principle is the cultural context. And so what we mean by that is the influences, the cultural influences that individuals, groups, and organizations bring to a response environment. We encourage folks, trainers, preparedness planners, to use this approach to ensure that their responders' needs are being met.
The next step is moving from the theoretical model perspective and moving into the hard copy, rubber meets the road. Okay, how do you accomplish this? And so what we have and what you'll be working with today is a comprehensive toolkit for public health investigations that touches on there's different roles for different people in a response. So this checklist is a generic list of items that someone in that supervision position, so they go through this as the first step in just-in-time training, and it takes probably about 20 minutes to go through. Our team leaders, their job is to take notes on the briefing. Each of the leaders should have this notepad in your packet, and it correlates, there's prompts for space to write on here, and what this is intended to do is be pulled off like this and used in the next section. The training guide is this spiral-bound booklet, and it comes in 3 parts. It comes in an introduction and orientation for the person who's going to be serving as a team leader to help them get themselves organized around, okay, what do I need to do now? And then we break up the curriculum for just-in-time training into easy-to-understand units. When you only have 5 minutes, we really want you to focus in on the gold bubble. The gold bubbles are the key information points that you need to get across if you have a shortened or condensed amount of time to do your training. What is really great about this is that there are prompts in each unit in the training guide that say, see Go Guide, page 3. So you're asking, okay, so what's a Go Guide? The Go Guides, which you'll receive one today for the use of the training, are our responder cards. And these are intended to be worn like on a lanyard. This is intended to be a condensed, portable version of just-in-time training that you can wear throughout your shift. And it covers a chain of command file. It covers pretty much every piece of information, but the cross-reference in the training guide where it says, you know, follow along on page 3. So for those visual learners, they can use their Go Guide as the visual cue to what they're hearing from the trainer.
So welcome, and thank you all for coming in today, given the tremendous situation that we're in. I want to remind the team leaders to take notes on the information used during the I-JITT so that you can have those with your team. The situation right now is that there was an anthrax release at Geldwin Field on March 28th. The release did occur in a soccer game. There was a large Hispanic presence at the game, so we are trying to include in each team somebody who is Spanish speaking. You know, in terms of other cultural pieces, most of the people in this room that I see do deal with members of the Hispanic community pretty regularly. We may see extended families. You know, the explanation of prophylaxis for people who are feeling well could, you know, come up, and how to explain that. So think about how you might message that with folks. Make it very clear that, you know, we're just there for the health piece, that we're not there for any other government issues.
All right, welcome everybody. Thank you so much for being here. I realize it's a pretty scary situation out there right now, and I hope that you guys, I want you guys all to take good self-care, and I hope that you've been able to, you know, talk with the family and everyone's feeling all right about things, but we do expect you to be here for the next 8 hours or so. So you heard Amy talking about our objectives of this response, and they are to, and this is where you guys come in, it's really to help identify any suspect cases of those who have been exposed to anthrax over at Geldwin Field, all right? So we also need to get those potentially exposed over to our points of dispensing, okay? And in your packet, there's some information on where those points of dispensing sites are. As she mentioned, there is a large Hispanic community that may have potentially been exposed because it was a game against Mexico, and so they had a large following. We have language and translation resources. Teresa, do you speak Spanish?
I do.
Okay, so Teresa is a fantastic resource for you guys. So again, stay within the responsibilities of your job action sheet. Do only what you can handle. If you feel like you can't handle anything else, come to me and we can talk about it and figure out what needs to happen, okay? Okay, so let's go through your job action sheet. This is your job. These are the things that will be expected of you in this position. What I want to do now is switch gears, okay? We're going to do some practice, you guys, so that you hopefully feel a little bit better about what you're about to do. I'm going to give you each a caller profile, all right? You guys will each be one of these callers, and then you'll practice using the script and the call log, and then you'll switch. So what I want you to do is partner up, okay? One of you is going to be the caller, the other one is going to be the technician.
So you were at the Geldwin Field on March 22nd?
Yes, I did.
Oh, okay. And do you think you've been having any symptoms consistent with anthrax exposure? I can give you a few of those if you need to know them.
Right now I am feeling very nauseated, and I don't feel really well. I feel very tired.
I can refer you to one of the places where you can go and get evaluated if you would like.
Is this going to be for free?
Yes, for free.
Okay. And it's going to be nearby my house?
What area of town do you live in?
I'm in Gresham.
Oh, in Gresham. Okay, yeah, I can give you the name and address of a place where you can go. Do you have any other questions right now that I can answer about anthrax?
I just want to get in and get my medications. Now, I do have another question here. Are you going to call to make an appointment for me, or what should I do?
No, you just go and show up there, and they will walk you through the process, and someone will see you no matter when you show up.
We're curious to know if you feel like this approach is feasible during a response, truly. And maybe not the whole, comprehensive package, but.
As someone who's had to train 10 years ago with a large group of people in a just-in-time training, I think these tools are pretty darn good because there's like a couple of major things that we have to talk about before we actually do our piece. And it would be easy to forget everything and just do the thing that we thought we were supposed to do. But when it talked about safety, chain of command, media, I mean, those things are actually pretty important. And if you don't know this, you can really mess up badly. So I liked it because it really did make me talk to my group about things that I would normally blow off totally.
Thank you all for coming. We were so excited to have you. I hope it was of value, and we'll be in touch.